Measles is spreading in the United States and across the world, and we need to talk about it. So in 2023 in the United States, there were 58 cases of measles across 20 different states. And already in 2024, we have 35 different cases in 15 different states. You can see a list of those 15 states right here, and importantly, Florida. We know that on February 16th, there was a third grader at Manatee Elementary School, I believe, that was infected with measles. And since February 16th, there has been 6 other cases of measles reported from that elementary school. So let's talk about measles. Measles is a highly contagious virus where following exposures, 90% of susceptible individuals will get measles. That means those who are not vaccinated. The symptoms of measles, or the 3 C's of measles, would be cough, coryza, conjunctivitis, and you could throw in another one for Koplik spots, although that starts with a K. The other symptoms of measles would be a fever, malaise, and then a rash. The classic stages of measles in an immunocompetent individual follow 4 stages. The first one would be incubation, which lasts about 6 to 21 days. The next would be the prodrome, which is about 4 days. And this is where you develop fever, malaise, anorexia. And then this is followed by those 4 C's, the cough, coryza, conjunctivitis, and Koplik spots. Then you get the third stage, which is the exanthem or the rash. And this usually follows 2 to 4 days after the fever. Classically, this rash will start on your face and your head and then spread throughout the rest of your body. This rash will usually subside in about 5 to 6 days, and then you move on to the last stage, which is recovery, which is kind of getting over this cough, which can last for, 2 to 4 weeks. The treatment of measles is generally supportive care. There are 2 treatment options, vitamin A or ribavirin, but those are in certain situations. The complications of measles is usually secondary infections with pneumonia or diarrhea. There are some more severe complications of pneumonia, such as acute disseminated encephalomyelitis or subacute sclerosing panencephalitis, which is actually an autoimmune response that happens 7 to 10 years after the original measles infection. So next, importantly, how do we prevent getting measles? Number 1 as a global community is by creating herd immunity, and that means getting vaccination rates above the 95% mark, and currently we're at around 93%. The vaccine against measles would be the MMR vaccine, and after just 1 dose, you have about 93% protection, and then after 2 doses, it's greater than 97%. The other part is infection control. That means any infected individual is contagious 4 days prior to the rash and then 4 days after the rash, and they should be isolated. This is on the spread in the United States. There's still really good news, and that is this is a virus that can be eradicated through public health measures such as vaccination. If you have yet to vaccinate your children or you have not been vaccinated yet, I would highly recommend talking to your doctor about it. Stay safe out there and keep an eye out for the 4 C's of measles.